So I just want to talk about a misconception that home insemination is the same as donor IUI in a clinic setting. So home insemination is where a same-sex couple ask a male donor, often an acquaintance or a friend, to donate some sperm. That sperm is put in a syringe, and at home the syringe is put into the vagina of one of the female partners around the time of ovulation and hope for a pregnancy. So people doing this should be aware that it comes with a few limitations and a few risks. The first risk is infection control. Donors who donate in a formal donor program in the clinic are screened rigorously for infection. So they are screened before they donate, and they are screened 3 months after they donate. And in that 3-month period, that sperm ideally is quarantined and can only be used after the second test. The reason why we do 2 tests is that the first test will pick up infection that have been acquired a couple of months before they donate. The second test will pick up infections that were acquired around the time of donation or just before donation, which means that it will show up in the sperm, which has an infection risk, but won't show up in those earlier sets of blood tests. So people who undergo home insemination won't have quarantine, and therefore there is an infection risk, no matter how well that couple may know the donor. The second issue lies around timing. A lot of couples will actually use home ovulation kits and so forth to actually time their ovulation. These kits are okay for seeing whether ovulation has happened. In terms of whether they're good for pre-ovulatory timing, that is very much to be debated. The reality is that home insemination or any kind of insemination, the sperm actually needs to be in the fallopian tube waiting for the egg to ovulate. So that is, once you put the sperm in the vagina after ovulation, that's too late. Couple of hours before ovulation, that's also too late, because the sperm needs those hours to track back up into the uterus and into the fallopian tube. The timing is very important in that it needs to be there waiting for the egg as it goes down the fallopian tube. So the only way we can do this timing accurately is actually via blood tests, serial blood tests, and a clinician making a judgment call based on those blood tests when is the best time to do IUI. The third major issue, and this is a big one, about home insemination is that there is actually no binding legal agreement on any party. So what I mean by that is that as far as society and the law is concerned, my understanding is that there is no formal donor agreement. So that is, the donor may not be viewed as a donor automatically, and therefore that donor is not protected from future parental responsibilities and does potentially have parental sort of rights to any child reproduced by donation. In the clinic setting, there is a rigorous legal process along with implications counseling that says you are providing sperm as a donor. You will not have legal access to any child born from donation, and you cannot be asked by the commissioning couple for example, child support for any child resulting from that donation. And obviously that's there to protect both the commissioning couple and also the donor. That protection does not exist in an informal home insemination scenario. And whilst you may go into this with the best of intentions, everyone is clear on what their roles are, things change, perceptions change, and there is then no protection for either the donor or the commissioning couple regarding the sort of the involvement in future offsprings. So home insemination is cheap, it's convenient, but it does have a series of risks that makes us say that in a donor situation, it is best to go through a clinic.